In this video, we'll discuss nipple eczema or irritation of the nipple. Believe it or not, this is a very common condition, and there's so much bad information out there as for how to manage this condition, leading to prolonged suffering and a lot of frustration on both the patient's part and the healthcare provider part. So we'll talk about, first of all, what is nipple eczema? Second, what could look like nipple eczema but is not nipple eczema? What to avoid when treating nipple eczema, and then what to do and when to see a dermatologist. So nipple eczema, as I've mentioned, a very common condition of the skin, especially affecting women, sometimes related to nursing, sometimes not related to nursing at all. In fact, the majority of my experience are not related to nursing. They're just persistent over the skin of the area, and the patient just doesn't know what to do with this and who to turn to ask what needs to be done there. The condition usually looks like red, flaky skin over the nipple and the areola area, the skin surrounding the nipple. Now, the redness can be pinkness, redness, or purplish areas, depending on the skin type or the skin color of the person suffering from the condition. And in many cases, it could be mixed with darker discoloration over the area that is a result of eczema that's burnt out, went away, and left some discoloration in its wake. In many cases, nipple eczema is itchy. In some cases, it can be burning. And in more severe cases, where there are cracks on the nipples or the areolas, this can actually be painful and really stinging, leading to a lot of suffering over the area. So that obviously must be addressed with a lot of nuance, but also leading to fast resolution, fast improvement of the symptoms. So there are many conditions that can look like nipple eczema, but are not nipple eczema. They need to be managed quite differently. So what are some of those conditions? Well, conditions like seborrheic dermatitis or psoriasis can sometimes affect the nipple area and can look a lot like nipple eczema. They would respond to treatments that sometimes are in line with nipple eczema, but requires some different care and different follow-up strategies. Now, there are some infectious conditions that can affect the area that can look like nipple eczema as well, specifically tinea corporis, or ringworm of the body and the breast. Sometimes there's a condition called tinea versicolor, which is an overgrowth of yeast that grows naturally on the skin that can affect the chest area as well. And in some cases, a condition called impetigo, which is a superficial bacterial infection, can also affect the nipple area. However, impetigo usually rises very quickly and is associated with lots of pain and lots of oozing over the area, so it doesn't quite ring as nipple eczema. However, these more slowly developing types of impetigo can actually look like nipple eczema rarely. Now, there are other serious conditions that can affect the nipple that can lead to symptoms that are much like nipple eczema. Specifically, warts around the nipples can lead to painful cracks or hardening of the skin of the area. And then there are types of cancer that can affect the breast and can look a lot like nipple eczema or breast eczema, specifically a condition called Paget's disease. And then there are breast cancer types that can look like eczema as well. So, what needs to be done about nipple eczema? Well, as you know me, first and foremost, do no harm. Do not engage in practices that make your skin worse over the area. Some of those practices include, and you know this already, hot water. Anything above 104 degrees Fahrenheit or 40 degrees centigrade does not belong over sensitive, irritated skin. That's for sure. Do not engage, despite the reflex or the drive to clean the area out. Do not engage in soaping, cleansing, or washing of the area with detergents. Those are going to further undermine the integrity of the skin over the area that's already worked up. It's already struggling to hold on to those protective elements that provide a cover for the skin, protecting its integrity. That is already at a deficit with nipple eczema and sensitive skin over the area. So do not wash it with soap. Do not use hot water. Do not use the physical abrasives. Don't use sponges. Don't use brushes. Don't use loofahs. No scrubs, no exfoliants, no washcloths, no gloves over the area whatsoever. All that stuff, I know it sounds like a great idea, it does not work for you. It's making your condition worse, and you're spinning your wheels trying to clean the area up. As you may recall from my video about eczema, eczema, including nipple eczema, is not a cleanliness problem. It is a sensitive skin problem. Eczema needs to be left alone and protected at all costs, and then treated actively to decrease or address the irritation on the skin. Other practices that are complete and utter nonsense would be disinfection of the area, and this is something that a lot of people do reflexively as well. Disinfection with either alcohol or with hydrogen peroxide or benzoyl peroxide or other forms of disinfectant. Even using disinfecting wipes over the area is another thing I've seen. Those are completely harmful to the area, especially when it's already worked up. Another thing to avoid: antibacterial ointments or creams and antifungal creams. Both categories can be irritating to the skin, and if there's no clear reason to use them, you're basically throwing more fuel on the fire of the area. So what can you do? Well, first of all, as we go back to washing the area, use lukewarm water only to wash the area, and do it very gently. Don't use any strong streams of water trying to blowtorch the area or turn the area or clean the area in any way. There's no need to clean the area. The area is way too clean at this point. It's just worked up. It's very sensitive. So lukewarm water applied very gently to the area. When you dry the area, pat it dry, as in just patting dry, not rubbing dry, because the rubbing dry again would lead to additional irritation, physical abrasion of the skin. Then it's time to moisturize. My moisturizers of choice, as you know, are white petroleum jelly or my creamy Carnauba moisturizing balm, which is made with 3 edible ingredients. These are greasy, occlusive moisturizers, so your best bet would be to use a tiny amount of those moisturizers over the area, like a pinhead size or a drop size amount. Apply the moisturizer as often as the area feels irritated or itchy or burning, and you will notice that the area will actually tell you how often throughout the day it needs to be moisturized. The small amount will make sure that you're getting exactly what you need and you don't end up with any residue that'll stain your bra or your clothes. Now, if the area is worked up despite these measures and there are painful cracks, sometimes zinc oxide paste or ointment can come in handy to really soothe the skin further. And if that doesn't work, you may actually go to something called liquid bandage, which can seal those painful cracks and not allow the outside elements to seep in and irritate the skin further. Now, your condition under these circumstances, what I've just mentioned, avoiding the harmful practices and moisturizing the skin properly around the clock, tending to the cracked areas, should actually improve spontaneously by itself within about a week to 14 days. However, if it's not turned around significantly, at that point, it's time to see the dermatologist. Why is it time to see the dermatologist? Well, the reason is that the area needs to respond when it's mildly irritated, should turn around with what I just mentioned. If it's more severely irritated, the treatments that are available over the counter would not suffice, would not be enough to turn your condition around. So you would likely need a prescription medication, and you're going to get 2 birds with 1 stone. You're first of all going to get some peace of mind and a diagnosis of your condition, which could be something completely different. It could be something that is not nipple eczema, which could be the reason why it's not turning a new page or a new leaf. And the other thing you're going to get is prescription strength medication to treat the area. Now, with the proper skincare and appropriate strength treatment, nipple eczema should turn around within a week to 14 days of treatment in most cases. Obviously, there are variations of success here. Some cases turn around very quickly. Some cases turn around a little bit more slowly. But you have to get that time frame in mind, and you have to follow through the instructions, treat the area appropriately, and then make sure that you meet your treatment goals with your dermatologist. Well, thank you so much for watching this video. If you got some benefit from it, please hit the like and subscribe button, share it with your loved ones, and support the work of this channel. More great content coming your way. Thank you again for watching, and God bless.
Ryan Little.